Now, again, you might be contributing in the HRA, $2,000 a year or $1,500 a year to help that employee cover that high deductible. That plan is owned by you. There's no portability with that HRA. It doesn't go with the employee. So in essence, if that employee terminates their employment, their HRA coverage, along with the high deductible health plan, that's going to terminate as well. But that is a, quote, group health plan for purposes of COBRA. So it will be part of our COBRA offering when they leave. A health savings account, on the other hand, is owned by the employee directly. Now, it can be contributed to by the employee and by the employer, but it is owned by the employees. That's why it is portable and is therefore not subject to COBRA, because the health savings account is exactly what it says it is. It is a savings account. It is not a group health plan. So HSAs, not group health plans, not subject to COBRA. HRAs are group health plans and subject to COBRA. So when you are offering continuation coverage to an ex-employee, you should be including the HRA, and there is a cost for that as well. I think what we find in a lot of the COBRA seminars is employers will have a large deductible health plan, high deductible, and they'll have an HRA, and then if the guy terminates, they'll offer continuation coverage along with the HRA, but they don't add in any additional premium for the health reimbursement arrangement. Now, you should always calculate the premium. Now, that's one of the problems with calculating the premium on an HRA, though, is that the IRS has not actually designated a specific procedure. So usually an HRA premium is based on the actual claims experience. It's almost like you self-funded groups earlier. It's based on your total claims experience for the prior year. The maximum premiums you can have, though, are two. You can have a single HRA rate, and you can have a family or everybody else HRA rate. So there's an HRA under COBRA doesn't have to be free. There should be a premium attached to that HRA plan when you offer continuation coverage. So you have a wide variety of different health plans out there. There's traditional HMOs still available, although they've kind of fallen by the wayside. When I say traditional, that means you have to go in the panel for your medical care, or if you go out, you're not covered unless it's an emergency situation. And what we all know is that there is no such thing as an emergency situation with some of these carriers. But traditional HMOs have kind of gone by the wayside with the advent of preferred provider organizations. That's where you have two columns, for example. If you go to this doc and they're in the panel, you're going to get reimbursed at a higher level. You can go outside of that panel, but if you do, you're going to get reimbursed at a lower level. So the purpose of the PPO is to drive patients to the preferred provider docs. So you've got PPOs, in Michigan, we have what are called PPAs, preferred provider arrangements. And then you have traditional HMOs, you have traditional good old Blue Cross, you have traditional old group health insurance that has a $500 deductible, 80/20 to 5,000, 100% after that. Although I think most of us know in the health insurance industry, a $500 deductible nowadays, man, that's great. I would love a $500 deductible. I think a lot of employers, in an attempt to save money because the Affordable Care Act doesn't quite yet seem to be doing what it's supposed to do. I don't think that's a surprise. It's not necessarily lowering the premium.